Hello, I'm Dr. Roddy, and this is a Society for Vascular Surgery briefing on how to work with referring physicians. The major focus in most vascular surgical practices is patient care and quality outcomes. While holding these goals primary, one can also evaluate the process by which care is rendered in order to optimize the vascular surgeon's standing in the medical community and ultimately referral patterns. The traditional recommendations for practice growth include the concepts of affability, availability, and ability. First, affability. The surgeon needs to be friendly, courteous, and agreeable while involved in discussions with physicians, patients, and ancillary staff. Pages need to be answered promptly and in-hospital consults evaluated in a timely fashion. Discuss complicated case scenarios with the appropriate medical staff. Referring doctors are more likely to involve a colleague in patient care when they can communicate on an intellectual level and work under a team approach. Always remember that rumors spread like wildfire in the hospital when a physician goes on a tirade. This translates into nothing but negative press. Surgeons who create problems are avoided. Those who solve them are respected and sought after. Second, availability. Each hospital staff intermingles as a local community. There are medical staff meetings, weekly conferences, and discussions at both lunch tables in the cafeteria and at nurses' stations. Don't underestimate the value of these interactions, no matter how brief. When a physician is visible and interacts with his or her peers on a routine basis, that individual is more likely to be consulted on vascular issues. Hiding in the operating room, angiography suite, or office only increases the divide between services. Attend the medical grand rounds on topics that overlap with arterial or venous pathology. Volunteer for committee appointments. Exposure is essential. Third, ability. Good quality outcomes speak for themselves. Do not attempt the easy way out. Perform the completion study when appropriate. Do open surgery when necessary and use endovascular methods as indicated. Include the referring physicians on all documentation. Do not take on something above your level, especially when starting out in practice. Consult your partners for advice. Also, do not try to hide complications. Vascular surgery patients have significant comorbidity, and adverse outcomes are unfortunately present even under the best of intentions. Referring doctors understand this for the most part, and keeping them abreast of the patient's status builds credibility. Lastly, electronic medical records, or EMR, in both the office and the vascular lab are beneficial on many levels. They allow for transmission of legible documentation. There are also immediate fax options, which may improve communication in a timely fashion with the primary care physicians and other specialists. Remember that vascular disease is often not recognized and can translate into significant patient morbidity. Your affability, availability, and ability help not only your practice, but engender a constant awareness of vascular pathology. This knowledge may actually facilitate patient care that would otherwise be neglected. This briefing is made possible by a grant from Cook Medical. To learn more about vascular health careers, visit vascularweb.org.